So get comfortable with this picture. What is it? What is this picture? Use normal language, it's okay. It's the eye. Which part of the eye? Yeah, it's the retina. It's part of the retina. It's the optic nerve and the retinal blood vessels. So we call this the ocular fundus, okay? Back of the eye, the fundus. Which eye is it? How do you tell right eye or left eye? It's okay if you don't know. Yes? How do you know? Closer to the? Yeah, good, good, good. So nerve is nasal. That's how I remember that one. Nerve is nasal. Therefore, and so this is, so there's the nerve. Here's the nose. Patient's looking at you. So when you're looking at a fundus photo, they're always looking at you, obviously. So the schnoz is going to be here. So it's the right eye, okay? What's this area? Yeah, the very center is the fovea. And so what's this area that I'm circling around? Macula, yep. So the macula is the center of the retina, the fovea is the center of the macula, okay? There's your optic nerve. So the macula is temporal to the nerve. The nerve is temporal to the nose, okay? So nose, nerve, macula. Veins and arteries, okay? So these are retinal veins and arteries. How do you tell the difference? The veins tend to be darker and thicker, all right? The arteries, thinner, and they'll often have a sort of whitish appearance to them. So this is what a normal back of the eye can look like. And a simple way of thinking about it is everything at the back of a normal eye is either yellow or red or orange, all right? Red, yellow, and orange. And there should be nothing in between these blood vessels and the orange tissue. So it should basically be blood vessels superimposed on an orange background with a yellow nerve. If you're seeing black stuff back there, if you're seeing red stuff in between the blood vessels or yellow stuff, something's up. That's not normal. Often it is normal, but we're not going to show you, variants of normal. We're going to show you pathology. So I mean, I'll show you some abnormal pictures a bit later on. You'll see what I'm talking about. Honing in on the disc, I'll just point it out on this disc first. Just recognize that, okay, the disc is round, it's yellow, and in the center of the disc is a smaller round yellow circle, which is brighter than the rest of the disc. Does that show up on there? Yeah. Happy with that? So this is the disc margin, okay, the outside of the disc. This brighter bit in the middle, it's like a little hollowing out in the center of the disc. And that's called the optic cup. So you've got the optic disc and its margin, and then within the optic disc, you've got the optic cup. So there's the cup in the middle. There's the contour of the disc. This bit we call the neuroretinal rim. It's composed of neural tissue, basically. So going back to this picture, there's the disc, there's the cup. This stuff here is the neuroretinal rim. Why does this matter? Well, the main condition where this matters is glaucoma. So in glaucoma, the ratio of the cup to the disc, which in this case is about 0.4, I would say. The diameter of the cup to the full height of the disc, just under half, do you agree? Thereabouts, 0.3, 0.4, something like that. Similar in this one. In glaucoma, that cup-disc ratio goes up. Okay, so it goes up to 0.6 or higher. And I'll have a picture of that later on. So if you see two discs, right eye, left eye, and one has a much bigger cup than the other one, something's up. And if both of them have a very high cup-to-disc ratio, something's up. You need to think about glaucoma, all right? There's lots of other disc conditions which are covered in that lecture that I told you about on optic neuropathies, but that's probably the most important one that you need to be aware of, is the optic disc, the optic cup, and the cup-disc ratio, okay? All right, so that's enough anatomy. Let's now move on to some basic optics. So